Monday, June 14th, 2021. I'm Jonathan Lowe, and this is 5 Minutes of Proof, a weekly analysis of the science behind ozone therapy. Today, we're going to take a look at an article that was published by Dr. Frank Shallenberger in the Journal of Prolotherapy back in 2011. Let's jump into it. So what is Prolozone? This is really combining ozone and prolotherapy. We looked at prolotherapy last week. We're going to look at ozone therapy a little bit more this week. So he says this: Prolozone is a technique that marries concepts from neurotherapy, prolotherapy, and ozone therapy. It involves injecting various combinations of procaine, anti-inflammatory medications, homeopathics, vitamins, minerals, proliferatives, and a mixture of ozone oxygen gas into degenerated or injured joints and into areas of pain. So you can see there's a lot of different components that he's utilizing for his particular injections. I'm going to skip down as we look through this paper, and Dr. Shallenberger played with a number of things as he learned about prolotherapy and then neurotherapy and ozone therapy and combined the three of them. He played with a few different things and anecdotally looked at the evidence based on his patient responses. He said, what I discovered was that the effects of ozone therapy, unlike those from proliferative agents, was not interfered with by anti-inflammatory medications. Indeed, they seemed to be synergistic. So he developed a protocol where he used an anti-inflammatory mixture for the first 2 to 3 times. And then when inflammation was no longer a part of the clinical picture, he said, I started adding in various proliferative agents. The one that he used most commonly is sodium morate. So this is first control the inflammation, and then let's create that healing cascade through a little bit of oxidative stress and a little bit of inflammation. He says, I believe that Prolozone works by improving oxygen utilization in a localized area of damaged connective tissue, allowing it to heal and to restore full function. So that's an important thing. Now, when we consider the various components of this Prolozone injection, as he calls it, what do they do? So he says procaine acts to reestablish cellular membrane potentials. Remember, lidocaine is more commonly used in most of the prolotherapy type injections, but he recommends the use of procaine. Anti-inflammatory agents decrease edema and swelling. The inclusion of vitamins and minerals provides necessary substrates for oxygen utilization that in damaged tissues are often deficient. And finally, oxygen utilization is directly stimulated by ozone itself. That's important. That's the part of the equation that is missing when we're just doing prolotherapy. One last note about the effect of injecting a gas, and he mentions here how when you inject ozone, you don't have to be as specific and precise with your injection as you do with prolotherapy because of the fact that the ozone itself, as the gas expands and reaches those hard-to-reach areas. He says the first thing that most patients notice after Prolozone treatment is an almost immediate 50 to 80% reduction in pain. What are we treating? Well, there's a lot of things. Chronic areas of degeneration such as osteoarthritic knees, hips, ankles will regenerate. He says you can treat chronic back pain, neck pain, degenerated discs, degenerative and arthritic ankles, hips, knees, dental infections, man, lots of stuff, painful scars, pelvic disorders. So he's really treated pretty much everything. And he has this as a statement: the primary criteria for selecting a patient for Prolozone is pain. If it hurts, Prolozone should be tried. That is pretty inclusive. A couple more statements I want to get to, and then we'll just finish up. Prolotherapy requires many injections, whereas Prolozone only requires a few. This means that Prolozone is faster and typically much less expensive. Of course, the same is true of PRP, is that when we talk about Prolozone, it's much less expensive. Now, PRP may have some more significant long-term effects for particular conditions, and we want to keep all of those factors in our minds as we're choosing which injection we're going to do. Finally, Prolozone is especially effective when used intra-articularly. It can stimulate the regeneration of damaged cartilage in knees, shoulders, ankles, and hips. And then he goes into some case studies and makes some final comments, but that's what I wanted to bring to you today and pair it with what we did last week. Hopefully that's helpful. I'll look forward to seeing you next week.